Welcome. My name is Dr. Jim Will, and today we want to talk about something that I think a lot of people experience in their life, and that is depression. And I don't know if you've ever been depressed or not, but if you have, you know what I'm talking about, and it's not fun. I used to be, and I want to emphasize the word used to be, depressed on Sunday nights. And it was interesting because I've mentioned before the voodoos that you and I might have and might be carrying around, some baggage, some garbage that we may not even be aware of. My garbage or my voodoo that I used to carry around was my self-talk coming around as a young boy, growing up and going to grade school, high school, college, was here comes another Sunday night. I don't like Sunday nights because I got to quit playing. And I've got to come in and do my homework, which I didn't like school, and therefore I'm depressed. And the crazy part was that I was out of graduate school and I was carrying around and still dragging with me that crazy voodoo. And why does voodoo work? Because we believe in it. And I was carrying that around. And all of a sudden I said, well, wait a second, I don't even have school tomorrow. What am I doing? And that's the beauty of what we're talking about here, is that you can change some old beliefs and old habits and old attitudes that may be causing you pain and suffering very, very quickly if you'll examine what you're saying to yourself and what you're talking to yourself about. And in my particular situation, it was simply, stop. Do I want to be depressed on Sunday nights? If the answer is yes, I do, then go ahead and keep talking about it and you'll get it. And if the answer is, well, no, I don't want to be depressed on Sunday nights, what is it that I want? And you go back to the grocery store of life with a list of things you want rather than a list of things that you don't want. And you start to think about, okay, what do I want my Sunday nights to be like? Do I want to be around happy, productive people that are supporting me and that I'm supporting them and that we're enjoying life? Or do I want to be around a bunch of depressed and what I would call soap opera type of events? And if I don't want the latter, then okay, quit talking about it and refocus and redirect what it is that you do want. One other quick item. I was working with a architectural company, and the owner of the company asked me to visit with his assistant. And his assistant, a nice lady, came up and she said, Dr. Will, she said, can you please help me with my goals? And I said, sure. And she went over to her purse and pulled out a couple of pages of notes, and they were pretty worn. And I know that she had been looking at them for a long time. And the first one was, I don't want to be depressed. And the second one was, I don't want to be a nuisance to my boss. Well, I already knew from her boss that she was a nuisance to him, and now I find out that she was depressed as well. And I said, that's enough. I don't need to see any more of your goals. Let's rephrase some of these goals and see if we can't get some results that we might want. I asked her, I said, are you sitting there online with your computer? And she said, yes. And I said, let's go to Google and let's type in, I don't want to be depressed, and hit send. And thousands of responses came back. Literally hundreds of thousands of responses came back to her. And I said, okay, what's the opposite of if I don't want to be depressed, what is it that I want? And she said, well, I want to be happy. And I said, type that in. And literally millions of items came back, I want to be happy. And I said, you've got friends either place, so which one do you want to hang out with? And so if we will stop thinking about what it is that we don't want and refocus our attention on what it is that we do want. Do we want to be depressed? No. What is it that I do want? Until our next session, this is Dr. Jim Will wishing you the very best in life.